Hello, this is Larry Minnix. Thanks for taking a few minutes with me. Many of you are calling and writing to ask what our input into the Long-Term Care Commission is going to be. I can assure you those avenues will be considerable, and we're working intensively on it. Our board identified years ago that the financing of long-term care for the future is probably the most critical long-term issue that our field and our country faces as more and more families encounter problems with people in their families who need care and services on a long-term basis. So the Commission, though funded for a short period of time, we believe will continue to be a vehicle to raise public consciousness about the fact that here's a problem that most every family will face in their lifetime and yet is very difficult to talk about. The way we have input into the Commission, one of those ways is through colleagues in two organizations called the Leadership Council of Aging Organizations and the Consortium for Citizens with Disabilities. Just yesterday, our staff met with the staff director of the Long-Term Care Commission and other colleagues to go over our priorities. If you go on our website, you can see the principles that we stand for, which have stood the test of time in our association as principles that our board over the years had supported. Things like we believe that this is a national problem that deserves some kind of concerted solution. The Pepper Commission 25 years ago concluded that long-term care was an insurable set of circumstances in our lives, and we've spent a generation not creating a mechanism to do that. We believe that everyone should have access to some kind of at least catastrophic type insurance, but even more some kind of program that will help them meet daily needs, since most people suffering from various types of disabilities are living within the context of home and family. We believe that something has to be affordable for individual pocketbooks, and people should be incentivized to plan for themselves financially, and yet it's got to be affordable for the taxpayer to help those people who face catastrophe or simply cannot afford to meet their own needs. We believe that non-medical services should be covered, things like housing and help at home with meals, or anything that would help a daughter who works full-time that's responsible for her mom or dad could use to help with family caregiver support. You can see these principles, and I encourage you to download them, discuss them within your own organization, and give us feedback. Which gets me to our number one mechanism for addressing this problem is our board created last year a blue ribbon task force chaired by board member Dan Lynn of Presbyterian Homes of Minnesota to pull in member and non-member experts to step back and make our recommendations to Congress, the White House, and to the public on how long-term services and support should be paid for. That task force is well into its work. We look forward to giving you a report about that in the months ahead, and we will feed into the Commission our thoughts at any given time about how to address this problem. But it is very clear, unless there is public demand that a solution be found, it will not happen politically. This is why in your organization, in your family, you need to talk about this and let us know what you think. So go download what we've put on the website and send us your thoughts about how you think our country should address this issue. And if you've had a personal situation that you have tried to cope with, tell us what that is, because it's the sharing of those kind of personal stories that eventually get our political leaders to say, here is a problem that most Americans will face, and it's our responsibility as policymakers to do something about it. So give us your input and let us know what you think. And thanks for sharing this time with me.